I will share a little information with you on hypertension, also known as high blood pressure. What is high blood pressure? High blood pressure is when the force of the blood pushing on the blood vessel walls is too high. So someone with high blood pressure, their heart will have to work overtime to pump that blood. And also the arteries, which are the blood vessels that carry the blood away from the heart, are under great strain as they carry that blood. We refer to hypertension as the silent killer. Why? Because most people with high blood pressure, you will find that they have no signs or symptoms. So for this reason, it is essential that blood pressure is measured regularly. But in a case where there are symptoms to occur, they can include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, and buzzing in the ears. For severe hypertension, that could cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, just a few to mention. Now we're going to go through the different stages of blood pressure. Blood pressure is considered normal when the systolic, which is the upper number, is less than 120, and the diastolic is lower. The lower number is less than 80. Elevated blood pressure is a systolic of 120 to 129, and the diastolic of less than 80. Hypertension stage 1 is when the systolic is 130 to 139, and the diastolic is 80 to 89. Stage 2 is when the systolic is 140 or higher and diastolic 90 or higher. Hypertension crisis is when the systolic is 180 and over and the diastolic is 120 and over. And at this stage, this is where you need to seek medical attention immediately, without any pause, without doing anything else. You should get to the hospital as soon as possible if you reach the crisis stage. In case you're wondering how someone is diagnosed with hypertension, usually in the hospital setting, we would take the blood pressure that are elevated 4 hours apart. So if you come to the hospital and you have elevated blood pressure stage 1 or stage 2, we would recheck that pressure again 4 hours after that. And then the doctor will also advise you to go to the nearest health center and check it for a week every day before they actually diagnose you with high blood pressure. So I'm going to go that again. How we diagnose high blood pressure in the hospital setting. If you come with elevated blood pressure, we will check it like 4 hours apart. Also, we will give you treatment in between to make sure that it goes down if it's elevated. And then the doctor will give you a referral to the nearest health center, and there you will check your blood pressure for 1 week and record it, and then bring it back to the hospital. And then that is how the doctor will actually diagnose a person with high blood pressure. What are the risk factors for hypertension? Modifiable risk factors include unhealthy diets, excessive salt consumption, a diet high in saturated fat and trans fat, low intake of fruits and vegetables, physical inactivity, consumption of tobacco and alcohol, and being overweight or obese. Non-modifiable risks include a family history of hypertension, age over 65 years, and coexisting diseases such as diabetes or kidney disease. Food to best use for hypertension are fruits and vegetables, especially dark green leafy vegetables, lean meat such as chicken or chicken breast, also fruits. Eat less of pickled meat, things like ham, sausage, canned fruits, sardines. Food to avoid are like fast food, sugary food and drinks, red meat such as beef, pork, salty food or processed food and packaged food. Also avoid alcohol. Why? Why must we avoid these things? Because food high in salt and sugar or trans fat can increase the blood pressure, which will do more harm than good. So for some people, they may be diagnosed with high blood pressure, but they find it hard to have a diet without salt. What you can do, instead of adding salt to food, you can use alternatives such as the fresh seasoning like shallot and celery and carrot. Those seasoning will add flavor to the food, and trust me, you won't even miss the salt. Some complications of uncontrolled hypertension may include serious damage to the heart, and excessive pressure can harden the arteries, and that will decrease the flow of blood and oxygen to the heart, and this could also lead to elevate the pressure and reduce blood flow, and can further lead to chest pain, heart attack, heart failure, irregular heartbeat, which can lead to sudden death. Hypertension can also burst or block the arteries that supply blood and oxygen to the brain, and causing a stroke, and this could cause a stroke. A key fact of hypertension is that it is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. So you need to remember that hypertension is a serious chronic illness, and it should not be taken for granted. So today I'm urging you to take control over your health. If you're hypertensive and you're not in a clinic, join one today. You can ask your doctor more about hypertension and how you can lower your risk in developing other illnesses like heart conditions and kidney failure and so on. So I hope this little information was helpful. Until tomorrow, listeners, I am Alicia Solomon, the founder of Royalty Home Care and Private Nurse Services, and you can call or WhatsApp us on 666-3598 or send us a message on Facebook at Royalty Home Care and Private Nurse Services. Thank you for listening.